Well, everybody, I'm delighted to welcome you all back to another one of our weekly seminars from the CeADAR Centre, and I'm delighted today that we have Lilian to talk to us about a subject which is a little bit different from our usual. So I'm delighted that Kwan has managed to persuade Lilian to give this presentation, and we were just talking there that Lilian has got some good news, which she probably will announce later. But again, we're delighted to have you here today. Thank you very much for coming along, and thank you as well, Lilian. So I'll pass over to Kwan to introduce our speaker.
Yeah, thank you, Edward, for your introduction. So yes, now I just talk a bit about the format of the talk. So for each talk, we have the speaker to give the presentation for 40 to 45 minutes, and the presentation will be recorded with the speaker agreement. Then after the presentation, we will have the question and answer, which will not be recorded. So for the talk today, we have Lilian, who is the Marie Curie Fellow of CeADAR. And yes, as Lilian just told us, Lilian is going to be a lecturer in University of Limerick, right? Yes. In January. And the talk today will be about challenge and perspective in gait assessment using wearable devices. So I hand it over to you, Lilian.
Okay, so thank you. Thanks, Edward and Quen, for the introduction. So yes, I'm a postdoctoral researcher in University College Dublin, where I'm affiliated to the School of Public Health, Physiotherapy and Sport Science. I also work with CeADAR as a research fellow and Kinesis Health Technology, where I've been doing research on user experiences. So I'll start with a question for all of you there. How many of you use any app or device to keep track of your activities? Just to reflect on this. You can share your answers in the chat if you like to. And if you do,
I have a smartwatch. So yeah.
Anyone else who is wearing smartwatches?
I use sports tracking devices.
Okay, devices, or it's just a device, or it's just an app, or on your phone?
Both, mainly an app, but connects to a sensor as well.
Okay. Anyone else? How many of you knew how many steps you did yesterday? Like, you don't have to have a precise number in your memory, but just have you been checking your activity lately? Do you have, sometimes the apps are just there running in the background of your phones, counting your steps. And then if you do, how do you think this information can be used or useful for improving your health? Do you think there is any connection on this number of steps and how your devices have been tracking your activity and your health outcomes or even health conditions? So this is what I'll be talking about. Those questions are related to my research. In this presentation, I'll be talking specifically about Gait and the association between Gait and health. Then I'll do an overview of the process of Gait data collection and analysis. And in this, I'll be presenting a recent publication. So it's my most recent paper on Gait assessments for persons with multiple sclerosis. And then in this paper, I'm presenting a novel approach that I hope will be helpful to enable Gait assessment from wearable devices. And I'll finish with some results and perspectives. So Gait is the ability to walk, and the performance of walking. And Gait, it's very important because it's the result of a fine tune of all neurological, motor, and cognitive. So it's neuromotor coordination. And it's fundamental to clinical evaluation. So I mentioned my paper is about the clinical data of people with multiple sclerosis. So in the process of evaluating development, even like children, gross motor development, or aging, process of aging, or many diseases, physiotherapists and GPs and medical doctors, they will be evaluating how a person's walk. It's a result of all this thing. And so I know many of you, and there has been a lot of discussions in literature, especially with this capacity of wearables and multiple technologies and multiple sensors in the home to recognize the activity and recognizing walking and different walking patterns. But I think there is still a long way to go between the activity recognition, so recognizing, detecting a body, recognizing that it is a person, this person is walking, and the path where it will be really useful information for health and health assessment. And so we'll be talking about all of this. So the goal of this presentation is to illustrate this analysis of gait data from body-worn inertial sensors that I hope will show some perspectives for wearable devices, and then discuss the impact of this process and how it can be done from for allowing health assessments and more health outcomes. So this is a quick snapshot of my recent publication. It's called Short Bouts of Gait Data and Body-Worn Inertial Sensors Can Provide Reliable Measures of Spatial-Temporal Gait Parameters from Bilateral Gait Data for Persons with Multiple Sclerosis. So this publication, this paper, research was done with Barry Green from Kinesis Health Technologies, Gideon McManus, that's also a researcher in Insight Center in UCD, Niall Tuberty, who is a professor in UCD, but also a clinician neurologist in St. Vincent's Hospital, and Brian Caulfield, who is the director of Insight Center in UCD. So multiple sclerosis is a neurodegenerative disease, and because of the decline on the neurological system, there is a high prevalence of gait impairment. One of the measures of multiple sclerosis, the disabilities and the impact of this decline will be the Expanded Disability Status Score, so EDSS. There are 10 categories from 0 to 10. 0 to 4.5, they are ambulatory, so they can walk normally without aid for, I think, about 300 meters. More than this, the gait impairment will be more, let's say, prevalent or more stronger, so they will be needing a mobility aid. And then level 10, actually, it's death because of the consequences of this disease. So far, most of gait assessments can be done in a subjective way. So there will be professionals that are skilled and experienced. They will be just observing how people walk. And from this, they can evaluate any difficulty, pain, or asymmetry. But now, because of technologies, it has been used in a certain time now, we can have objective measures of gait. And now, because we're talking about wearables and sensors that can be used more easily at home, we'll be going from this just quantifying gait that could be like counting steps and the length and the duration of a walking task to the biomarkers. So the possibility of using this quantitative data and several parameters to really categorize, so describe how a person is walking and how it changes over time. So for people with multiple sclerosis or any kind of other neurological disease, it will be helpful for monitoring symptoms because they can vary during the day. They can also vary according to the medication and time after medication, so evaluate the therapeutic interventions and also to allow early diagnosis. So in this study, we have data from 37 persons with relapsing remitting multiple sclerosis, 23 of them were female. Mean age is 45 and their EDSS was between 1 and 4.5, which is they could walk the 20 meters task that was required without mobility aid and safely. So yeah, so this is about the data collection. So we were using Kinesis Gait. So I should have them here. So there are 2 inertial sensors that are attached to the participant's shin, and they'll be walking the 20 meters task. And those inertial sensors will be sending data directly to the tablet to allow the evaluation for the clinician doing the assessment. So it's a supervised walk. So for this data, the data was collected in an outpatient department in the hospital. So it's a well-controlled environment, and we're sure about the task and the length of the task that the persons were doing. So this is an example of the raw sensor data. So the data that's recorded in the tablet, so the data that's collected from the sensors, we have from the timestamps, we have the angular velocity and how it varies over time. And so I'm presenting here the data from the gyroscope on the Y sensor axis. So it's important to remind, for those of you who have worked with motion capture before, so during my PhD, I was using motion capture with infrared cameras, which requires a very controlled environment. We could have this kind of signal that will be really representing the trajectory of a part of the body. In this case, this is not. This is the angular velocity, so how fast a movement is done. And because it's also an inertial sensor, there will be some like compensatory movements or any other movements in the sensor that also capture in this signal. So there is a work of treating the signal and get to something that can be interpreted as human movement after. So this is an example of how from this signal data we can identify the gait events. So what I'm talking here, so the ICs will be the initial contact, which means the heel strike on the floor, on the ground, and TC would be the terminal contacts, which is related to the toe off. When you're talking about gait impairment, terminal contact and initial contact, it's more correct because some people will not do this movement of first the heel and then leaving the toes. Some people have more another kind of steps, or feet can sometimes even be much more closer to the ground. And so here, what you can see, it's the identification of the gait events that can allow us to count the number of steps, but also to extract a lot of gait parameters. And what you can see here, I'll be counting the gait cycles. So the number at the bottom, it's the time, but also you can count how many steps and how many gait events have been identified. So for the gait, the main gait events are stance. It's the time where the heel, from the heel strike to the toe off, or actually the time where the feet is in contact with the ground. Swing is from toe off to heel strike, or the time where the leg has lifted the leg from the ground. There's no contact with the ground. And then there's a difference between step and stride. So usually when you're talking about step, it's from one feet to the other. So when you have this movement of one feet, so it's the heel strike and toe off of one feet, and then the other feet hitting the ground. This could be a step. But then stride, it's for the same leg. So from the heel strike, you have the toe off, and then you have the leg swinging and then touching the ground again. And this will sometimes take the time for the heel strike again. So it's from heel strike to heel strike. This will be a total stride. And then when you have one step or one stride for each leg, you have a gait cycle. So it's interesting because you need to evaluate from gait cycles, you need bilateral data. This is why kinesis gait was great for this research, because you could have data from the two legs and the two feet at the same time. So from these gait events, we can extract the gait parameters. So we'll be calling spatiotemporal gait parameters, those that will be quantifying the time and the length between those events. For example, an average straight time or average stride length. There will be also the variability, which for kinesis gait and this paper, we'll be talking about the coefficient of variation. Some papers and some authors also describe the standard deviation between those measures. And because we have bilateral data, we could talk about asymmetry. So we can compare how one leg moves differently from one in another. So we'll be calculating the gait symmetry index. So for example, it's the average of the measures of the right feet and the average, how the average of how the left minus right. Then you have the difference for every stride and every stride time, for example, and then you have asymmetry of stride time. And then you'll be dividing this by the average for the full length of the task. So all the lefts minus left. And so when you have a negative value, it will be like left leg asymmetry. I can give more details on this later if you like. And then here, if we're talking about wearable devices, the advantage is that they are portable. So they are usually much more cost effective So I mentioned devices like infrared cameras that will be requiring a much more controlled environment in a dark room where there are no interferences. Or if you think, some people are talking about kinetic or even video cameras. It could be cost effective, but then you don't have the same data, and there is still a lot of evaluation going on. So wearable devices are also suitable for controlled and non-controlled environment. So the idea here is try to move the gait assessment from a clinical environment or a laboratory in a university to other settings like the patient's home or any kind of ambulatory environment. And because it's less intrusive and sometimes easy to have, easy to charge, there's a potential for continuous assessment. As I said, for people with multiple sclerosis, the symptoms can change over time, can change even during the day. So having this kind of short, easy to use devices would enable, if not a continuous assessment, as some smartwatches can do, a frequent. So we can take snapshots of a person's gait during the day and then try to compare how it works. There are some downsides, so some problems that will be, for example, usability issues. As I start talking, the inertial sensors are white boxes, but the orientation is very important. So if you put them upside down, you don't have the same kind of data. So this is the kind of things that you need to train the users or train your models or train your algorithms to try to identify any kind of errors, send messages to the users so they can correct, or even try to filter and change the data. Data will often be very fragmented, because when I was talking about gait, sometimes some studies will be running on treadmill and they have this controlled environment where people will be walking in the same pattern or straight line for a long time. When you're talking about home settings, that's not always possible, because you have short corridors or furnitures. And if you're talking about free living environment or community ambulation, you might have steps or obstacles on the ground or uneven floor. And so when you need a gait assessment from a certain number of strides, you usually need some clean data, and that's not always possible. And also the number of sensors. So I'm talking about the potential of bilateral data. You usually need 2 sensors, one on each side, to evaluate. And then this, again, there's this part of cost effective and the part of calibrating the signals and making sure that we're collecting data at the same pace. So in this paper, I'm evaluating a novel approach that I hope will be helpful with this part of fragmented data from gait assessment. So what I'm doing, I'm extracting short bouts of gait data from the full length of the task. And then I'll be reporting the number of gait cycles with the results of the analysis on the gait parameters. Let me see if I can explain this better. So the idea behind this is to identify how many gait cycles I needed to represent individual gait. So there will be, I'll talk more about the gait parameters. Remember when I talked about the gait variability. Some studies will tell that you need like 100 or 200 steps to have a very good measure of a person's variability of walking. Gait variability is something that's fascinating, because if you think about even a heartbeat, it's not flat. You cannot expect that it will be a rhythm like a metronome. There will be a variation. It's not always at the same time. And this variation is like a personal signature. It varies from an individual to another. And this is also, this will be varying over a person's age. And if there is some kind of disease or neurological impairment, you can capture this. So measures like gait variability are very important for health assessments. And then gait symmetry needs to be further explored, but there is great potential there too. And the problem, so one of the problems of this fragmented data is how to have reliable measures. So how can I make sure that the data that I'm collecting from a person now, if I use the same method again, I can still have the same results. So in this paper, I'm evaluating the reliability from calculating the intra-class correlation coefficients. So it's an intra-session reliability. The participants have done two times the task. They walked and they walked again. and then I'm doing to see if there is any difference from the first and the second time they did the task, extracting on the gait parameters and trying to identify which gait parameters are more reliable, which gait parameters can be used from data explored through data collected with wearable devices. So the reliability that I'll be presenting in the next graphs represent the variation of reliability according to the number of gait cycles included in the task. So if I could get back and show when I showed, let me see if I get back to this graph here, you see, so this is the full length of the task. In the beginning, there will be some variation there you can see on the graph, and this is because of gait initiation phase. And then the phase should be at more, let's say, reasonable or stable rhythm because it was in a controlled environment. And at the end, you could expect some more variation because the person knows that they are arriving at the end. There might be some sign on the floor, or they knew that you will be walking just for a period of time or a distance. And so they will be changing the gauge to prepare themselves to stop. So when you're collecting data from Gait, you have to be aware that there's different phases of Gait. So the beginning will be the Gait initiation phase. At the end, you might wait for a Gait termination phase. And between it, you have what we would call steady gait. But now I'm talking about people with some potential gait impairment. So I can't even wait or expect this to be very even. And even if it's even, this is a controlled environment. Sometimes you might have changes there related to turns or obstacles. Or in the case of gait impairment, you might also have some problems related to the gait impairment itself. So what I have done in the first graph, you see there's lots of gait cycles. So I've been extracting short bouts of gait. So I have the full length of the task will be around, I don't know, maybe 12 or 15 steps or strides or gait cycles. So I'll be taking parts of it. I'm taking the first 3 steps off because I'll be considering those are related to the gait initiation phase. I'll be taking off the end of the task 2 so I can have a maximum number of participants included in my task. And then between these, I'm trying to see if I take just 2 gait cycles, how does it compare from the first trial to the second one for the same participant? So I have here this is for the spatial temporal gait parameters that are calculated as an average across the task. So I have stance time, stride time, swing time, step time. I can explain all this later if you need more information. Double support and single support, those are values that are interesting because double support is the time the person, in relation to the full length of the task, the proportion of time that the person has their feet on the ground. So they are double supported because both feet are touching the ground at the same time. If you're thinking of someone using a walking frame, they will need to move the walking frame before doing the steps. So those person will have a double support, proportion of double support that is higher. And if you're thinking about someone running or walking very, very fast, the double support will be almost 0% because the idea is that they will be just, you put your feet on the ground and then you take it off. You'll be kind of jumping. So double support, it's something that can be used to identify different kinds of gait. Like for example, if a person is walking or running. And then mean stride length and mean stride velocity, which will be considering more the spatial temporal parameters that will be reflecting on the length, on the space parameters of the task. So what this graph shows is that even for a very short number of gait cycles, like from 3, 4, or 6, I can already have a very reliable measure of gait. And this is consistent with the literature. So those parameters that I'm showing there, lots of studies in literature that have shown that from 4 or 6 gait cycles, I can have very reliable measures. And this is important because I was talking about the fragmented data. So if you can identify a person walking 6 gait cycles in the corridor at their own home, you can consider that the measures of mean, the average of spatial temporal gait parameters, you can use this to identify who is the person walking at that place, and you can still try to see any variations over time. However, I mentioned for persons with any kind of neurological condition or gait impairment, or even to study the aging process, variability of gait, spatial temporal gait parameters will be much more interesting, because this will really represent the individual gait signature, and this will be really affected by process like aging or neuro or motor diseases. So here we'll see that if I have a short number of gait cycles, there will be more variations between the first and the second time the person did the task. So they cannot still be very considered to evaluate to a health assessment or to evaluate gait. However, from 6 gait cycles extracted from the full length of the walking task, I can already have a better reliability between, so I'm comparing the results between the first and the second trial. And then it will be reaching an excellent variability when I have more gait cycles included in the task. So what I'm saying with this graph is that gait variability still have a very good possibility to evaluate gait assessments from wearable devices in non-controlled settings. But if you include more gait cycles, you have more reliable information. However, from 6, some parameters will be already reaching good reliability, as especially stride length variability, stride velocity variability, and swing time variability. And I also have step time variability there. However, double support variability, for example, it won't be very good. You need more data to evaluate this. So when you're doing activity recognition or gait assessment, or you're expecting to use this for some health assessment, checking the reliability of the parameters during the day, or for the data extraction method that you're using, is very important. So the recommendation from this graph is really check the reliability between the parameters that you're extracting from your task. And my third and last graph for this presentation is about reliability of asymmetry spatial temporal gait parameters. And this is very interesting because we need bilateral data. And this is very interesting because asymmetry needs to be further studied, but has shown great potential for people with neurological diseases or any kind of other health conditions that you could be assessing gait parameter. So again, we'll have, when you're having more gait cycles, you will have more reliability between the 2 tasks, or more tasks that the person is executing. However, you can see that some parameters like stride velocity and stride length will reach a very good or excellent reliability from 6, 7, 8, or 9 gait cycles, with representing a very short walking task. So it will be about 20 steps. However, some parameters like stride time asymmetry, apparently so far for this task and the method of extraction and analysis we're using, it cannot be really considered for something that's reliable enough for a health assessment. So again, doing the analysis of reliability allows us to define which gait parameters have more potential for health assessments. So I hope it's clear so far. So what I've been presenting is I've been calculating the intrasessional reliability of spatial temporal gait parameters. So I have gait parameters related to the average values during the task, the variability, and the asymmetry. And I'll be studying how it varies according to predefined number of gait cycles. So short bouts of gait that I'm extracting from the full length of a walking task. And I'm hoping this will be a novel approach to enable health assessment from fragmented gait data, as gait data that's collected from wearable devices, where you have a non-controlled environment. So it's hard to collect a very long walking task, for example, 100 or 200 strides without any interruption, making sure that the person is walking in a straight line. So the discussion also of this paper is our recommendation of using this kind of windowed approach. So when you're extracting short bouts of gait data, other studies in literature have also used this kind of approach. I'm insisting on the reliability analysis to see if the gait signature it's really corresponded to the same person according to different tasks or the same task during the day. And add the contextual information, for example, the number of gait cycles, or if there was an assigned task. For example, if you told your patient, or you know the person will be doing a health assessment at home, and you're telling them to walk 25 feet, or to walk 20 meters, or to walk 6 minutes on a row, to provide this information together with the results, because there is most of walking tasks will be depending on the length, on the duration. The person will adapt the way they walk if they know it's for a determined length, or if they know there is an obstacle. So providing the contextual information at the same time with the results. And again, gait variability, we have shown if you're using bilateral data, you can have good reliability of gait variability measures from at least 6 gait cycles, which is very good because again, it's from a short walking task. And the perspectives of using gait asymmetry parameters to evaluate neurological conditions, or even to monitor symptoms of persons with multiple sclerosis. So the conclusion is short bouts of gait data can provide reliable measures for persons with multiple sclerosis. We hope we have shown that wearable devices can enable gait assessment in non-controlled environment, such as ambulatory settings or home settings, or even free community ambulation, free living conditions. And there is a potential of gait assessment and quantified gait, objective measures of gait as digital biomarkers that could support the monitoring of symptoms of persons with neurological conditions. But as you have seen, there's a long path between data that we collect as activity recognition to something that can be really helpful and useful for a health assessment. So finally, the takeaway messages of my presentation are wearable data from step counting to digital biomarkers. You have this long way to go, but there is a lot of things that have been proven in this area in the past years, including the sensitivity of the devices or the methods and algorithms you can find in the literature that help you to improve the health assessment, and all the potential to use this data as biomarkers. Some also the impact of usability and context awareness. So if you're using a smartwatch, or the position of the sensors in the body, and how the information you provide to the user to empower them to understand how the data is collected, and transforming these data in something that's meaningful for them, and taking into account the context. If they're walking in a home, if it has been an assigned task with limited duration or length, or if they're just a free living condition. And then the perspectives and challenges on healthcare innovation. So we're putting sensors and collecting data from a lot of people in a lot of places. And there is certainly a great potential to improve healthcare. So here I'm just showing the references. So this is my recent publication on the short bouts of gait data. And I have previously done one on how many steps to represent individual gait. Some of application areas not related to health, it could also be, this could be also be used for example, representing gait on a virtual environment or augmented reality, or another part of entertainment, like I've been talking to authors working on dance applications, education, or sports. And these are the references that I used in this paper to estimate the gait, to calculate the gait parameters. So we have 2 papers explaining how the gait parameters were extracted from the raw data from the signal of the inertial sensors. So thank you very much for listening and for joining this presentation today. I'm glad to try to answer to all your questions.